So we started this over a year ago, and I started having kind of these casual online chats with people, and Lisa and I started doing a number of these a year ago, and I found that the interviews I did with Lisa were by far the most popular, that people really loved them.
They were a ton of fun.
They were a lot of fun. And I mean, part of it is that Lisa is such a dynamic person and knows so much about nutrition. But I think the other part of it is that nutrition is one of these areas similar, I find, to aesthetics, where it's so personal to everyone. Everyone has some kind of, everyone has nutrition in their life. So everyone's kind of thinks that they're a pseudo expert. Do you find that?
Yeah, get that every once in a while. Just every once in a while.
Yeah. So it's a great topic because it hits home with everyone, and no matter what you do, especially in health, there is a strong nutritional side to it. Anyway, I thought this would be great. I had so much fun with Lisa a year ago that we thought we'd start up having chats again. And the first guest that Lisa suggested was you, and she really thought you'd be a great guest, and I agreed with her. And you are really a super interesting guy. On the academic side, you're a renowned expert, and we'll let that ambulance pass. On the academic side, you're a Canada Research Chair at the University of Toronto. You are an expert in the genetics of nutrition and Nutrigenomix, and even equally interesting on the flip side, on the business side, you have started your own company, the Nutrigenomix company, which looks at personalized genetic testing and how that affects nutritional choices. So I'd like to get into all of that. I think it's all fascinating. I think people find it fascinating, but I'll start off with the basics of how you got into nutrition.
Sure. Well, I think when I came to the University of Toronto as an undergraduate studying basic medical sciences, my thought at the time or expectation was I was going to go to medical school. And then after your second year, you need to specialize in one of the basic medical sciences and the basic life sciences like immunology, pharmacology, or biochemistry. And I chose nutritional sciences just out of personal interest. So I was very much into a lot of athletics and recognized that nutrition obviously plays an important role. So yeah, it was just purely out of personal interest. And by the time I got into third and fourth year, I had done some research with some professors, and then I got really excited in the field of research, and it was all new to me, right? I had no idea what being a researcher entailed. And then as I discovered that, the work that we do as researchers is ultimately what goes into the medical textbooks that clinicians use. So I thought, this is really my calling, and haven't looked back.
Now, what about specifically genetics and nutrition? I think that's a fascinating area. I didn't really appreciate how in depth that field was. But when did you really get into the genetics of nutrition?
Well, that came about while I was doing my PhD, and one of the experiments that I conducted, the results were the complete opposite of what another research group had found. And we were looking at the effects of cholesterol on colon cancer and breast cancer in animal models. And, I thought, I'm a new graduate student. I must have messed up the experimental diets or, screwed up the study somehow. And so I went back through everything very carefully and saw that, things were done right. And when I compared our study with the previous work that was done, everything was the same except for the strain of mouse that was used. And so basically it's just the genetics of the animal that was different. So we repeated the experiment and did a kind of a head-to-head comparison between the strains, and sure enough found that depending on the genetics of the animal, the response is the complete opposite. So that's when the kind of light bulb went off and said, I thought to myself, wow, if two different mice can respond differently, then surely, two humans can respond differently based on their genetics. And this was around the time, so this was the late 90s. Just around the time when, we were going through the Human Genome Project. It was published a few years later, and there was a lot of interest and excitement in genomics and genetics. And then I went to Harvard and worked with one of the very few researchers in the world at the time who had integrated genetics into her nutrition studies. And so I trained with her in that. At the time, even the term Nutrigenomix wasn't even coined yet. And then when I started my research program at the University of Toronto in the year 2000, I established a research program that looks at the interactions between nutrition and our genetic makeup.
So this is really the cutting edge of your specialty. When did that really begin? Was that the early 2000s?
Yeah, so that's when I got my first faculty position and started doing my own research. It was then in 2006 when we published our landmark study in JAMA, Journal of the American Medical Association. So this year actually marks that 15-year anniversary of our first big study, where we showed that, depending on how people metabolize caffeine, coffee could either be good for them or bad for them. And so that was really kind of what put our research group on the map.
Yeah, and let's get to that. And I was going to talk about that a little bit later on, but now that we've kind of brought it up, I think it's a great segue into this point. I've heard you talk about the point of heterogeneity of people and how they respond to food. And I think it's a really astute point to make, because when people look at food and how foods react differently to different people, or people kind of have different responses to different types of foods, and how even studies can sometimes show completely opposite findings, or at least different findings with respect to the effects of coffee, for instance, the effects of chocolate, the effects of wine and alcohol. Can you explain that phenomenon of why you can have studies that show different findings, but they're not necessarily invalid?
Yeah, well, I mean, I think this is something that has kind of plagued our field of nutrition. Unfortunately, you tend not to see this in other disciplines, but the apparent inconsistencies among studies, right? We do often hear, sometimes in the newspaper we read that a study comes out showing that coffee is good for us. A year later, another study will come out and say coffee is bad for us, and yet another year, coffee doesn't do anything. And those inconsistencies are partly due to these studies being done on different populations with different genetics. And some people metabolize caffeine very efficiently, and they get rid of it from their system pretty rapidly. So for them, the caffeine in the coffee just doesn't stick around very long to do anything. And if anything, they actually benefit from the other substances in coffee, like antioxidants and polyphenols that actually have beneficial effects. So again, just depending on the genetics of the individual, or in some cases, populations, if you're just comparing results of studies done in different parts of the world, you're going to come up with different conclusions. And again, this has been somewhat frustrating. I know for not only consumers and the public who want to know how to eat better, but even for, or maybe even especially for researchers and clinicians, right? How do we weigh the evidence from two very well-designed studies, but that come to very different conclusions just because they were done in different parts of the world? And so this is really what our research strives to do, which is to reconcile those differences by saying, you know what, they're not really inconsistent. It's just that the genetics of the population is different. And here's the specific genetic marker that can explain why this group found that coffee is good for you and another research group found that it was bad for you.
I'm laughing a little bit that you brought up coffee first. Well, it's that's your research, but also when I first got my test done, way back when it was 7 genetic markers, I remember getting my report and being so nervous about my caffeine metabolism because I was probably drinking. Okay, I was a dietitian at that point as well, probably 8 cups a day. Probably 8 cups a day and not sleeping at night. And I'm a poor metabolizer.
Are you?
I am, like somebody else in the room, a poor metabolizer of caffeine. And yeah.
Wait, are you saying I am? Is that what my tests show?
Yeah, a little bit.
No, that can't. I can't be. I drink a lot of caffeine.
I know.
Yeah, we've got a surprise.
Risk.
Ahmed, we've got a surprise. Surprise number 1 of the day.
And it's funny because I like being a dietitian and knowing that I'm not sleeping at night. Like I knew that 8 cups of coffee per day, it was not good for me. But I didn't get motivated to make that change until I got the report back. And it was, here are your genetics. This is your genetic type. In your face, Lisa, this is what you're doing to yourself.
Well, I thought the exact same thing when Ahmed first told me about this study. And for the audience, maybe you should just describe this study that you found that there are different types of metabolizers of caffeine, and depending on the type of metabolizer you are, your risk of heart disease is variable. Is that correct?
Yeah. So we coined the term slow metabolizer of caffeine, which means that, we all have this particular enzyme that is active in our liver, and some of us have a higher functioning version of that enzyme that breaks down caffeine into water-soluble compounds that are then just eliminated in the urine. So approximately 50% of the population are what we would call slow metabolizers. And for them, they have an impaired ability to get rid of caffeine efficiently. They're still able to get rid of caffeine. It just takes them several hours longer. And so by the time the next day rolls around, they're having their next daily dose of caffeine, and caffeine is sticking around in their system much longer. And we're finding that caffeine is causing blood vessels to constrict. So it's impairing blood flow in various parts of the body to the muscles, and that's why it's impairing performance in athletes. It's also impairing blood flow to the heart, and that's why it's been linked to a higher risk of heart attack in those individuals who have the gene that make it take a little bit longer to get rid of caffeine.
See, isn't that interesting? Because I would think the average person thinks the opposite, that they require caffeine in order to improve performance, and probably because of the neurologic effects of caffeine as a stimulant. But I guess people wouldn't necessarily think about the rest of the effects of caffeine on their body and specifically on muscle and muscle metabolism.
And for some people, they will benefit in terms of performance, sport performance. Not you and I, but some other potential people could.
Yeah, and that's actually a study that we published about 3 years ago. And it got quite a bit of media attention. It was featured in the New York Times and the Washington Post and the London Times in the UK as well, where those who have, so caffeine definitely is used widely among, especially endurance athletes, as an ergogenic aid, because it does improve endurance performance, largely by affecting a person's perceived rate of exertion. So you just feel less tired, right? You're more jacked and you're gonna, you're able to perform better. But that turns out to be the case mostly in those who are fast metabolizers. So they get that quick buzz of caffeine, but then they get rid of it in time so that it's not impairing blood flow to the heart or to the muscles, rather, the heart as well. Whereas in the slow metabolizers, even though they still get some of that stimulating effect of caffeine that might make them feel that they can, go a little bit harder, because it's impairing blood flow to their muscle, they're actually not able to perform better, and they actually perform worse. And so that's another example of where, caffeine does improve performance in a lot of people, but it actually impairs performance in someone else. A lot of athletes just do it by trial and error, but they're often changing a bunch of other things. And we tested this using a randomized controlled clinical trial, double-blinded. The researchers, our team, did not know who was getting caffeine until the very end, and the athletes themselves didn't know if they were getting the placebo or caffeine.
That was my one point of contention with that research is I know when I'm getting caffeine, but maybe because I am not the greatest metabolizer of it, but it was how can that be double blinded? But it was an awesome research article. You guys did an amazing job.
Right. Yeah. So, technically they're taking a white capsule, but, there is this, so-called nocebo effect as well as a placebo effect. So we did actually ask people every time they took a pill, would you say that you just took caffeine? And you'd be surprised. It's not 100%, right? Sometimes some people felt that the placebo, had some caffeine, or that the caffeine, maybe because the dose wasn't strong enough, they said, no, that's just a placebo. But for the most part, people do know when they've consumed a bit of caffeine.
Yeah, I thought that it's funny that you bring this up, though, because I thought the exact same as you. I thought, for sure, I'm a fast metabolizer. I'm good to go with caffeine. I can drink whatever I want. I love my morning coffee. I have probably a couple cups of coffee in a day. I didn't actually get that result because that initial result wasn't part of what you had initially sent me. So when I didn't see it on there, I just assumed it was because I was really good with caffeine.
Yeah. Just didn't include it because you're amazing with it.
Yeah.
But you know what I really like, and I try to explain to people as well, is I love the specificity of incorporating Nutrigenomix. And what I like talking to people about are how, and we'll see this in the report, caffeine's in a couple different areas. Cardiovascular type exercise is in a couple different areas. There's a few different nutrients that fall into a couple different areas, and so it depends on what your goals are a little bit. Right. So if your goal is really, maybe thinking a bit better in the morning, maybe having a bit of coffee in the morning is okay for you. But if your goal is, if you're really, really worried about cardiovascular health, then probably not really having any would be ideal for you. So that's what I really like speaking to, and what the report really speaks to too, is that it breaks down into okay, are you worried about weight management? Are you worried about skin health? Are you worried about cardiovascular health? To me, we should be concerned about all of those areas, but it helps you in setting that, okay, what is important to you? Are you an athlete performing, or is skin health what we're really working on? So that's what I sometimes talk to people about. They're like, oh, I'm a poor metabolizer. And I'm like, okay, you do everything else to help with cardiovascular health. And so maybe if caffeine really helps you get going in the morning, maybe a cup for you is okay, right, to make you feel not so bad.
Yeah. And Ahmed, what about how confident are you that there are not multiple different genes that are affecting caffeine metabolism? So for instance, you've looked at one gene that looks at different alleles and how that affects caffeine metabolism. But again, how confident are you that you're not missing something else, and that perhaps in a different population, there's a whole set of other genes that are affected?
Yeah, great question. The nice thing about caffeine is it's the metabolism of it, and the biochemistry is actually fairly well characterized, right? Because caffeine is actually used as a probe drug because it has a very specific enzyme called CYP1A2 that's responsible for metabolizing approximately 95% of caffeine. So vast majority of caffeine gets metabolized through this single pathway. And this has been elucidated using very elegant molecular type experiments. But of course, there are other candidate genes that could function as targets of caffeine action. So caffeine binds to a number of different kinds of receptors. And we've actually looked at many of those other candidate genes. We actually have a panel of 22 SNPs, what we call single nucleotide polymorphisms. These are single letter substitutions within the gene or throughout the genome that could alter a person's response. And those are in several different genes that could potentially modify the effects of caffeine. And we have identified variations in some of these other genes in terms of how they can explain some of the other biological effects of caffeine. So for example, caffeine is known to elevate mood in some people, and there's variation in the dopamine receptor because we know caffeine functions by improving mood by enhancing dopamine levels. So for some people, depending on how they process dopamine, that explains whether or not caffeine has that mood enhancing effect for them or not. And so as Lisa mentioned, some people really do benefit from, just that even a half a cup of coffee in the morning, because it has great effects on their mood and energy levels. Whereas other people, a little bit of caffeine might actually give them the jitters and make them feel anxious. And so we oftentimes regulate how much caffeine we consume based on those immediate physiological effects. We don't regulate our coffee consumption because we're saying, oh, okay, well, this is going to affect my risk of cancer in 30 years from now. But we do rely on research that does tell us what the long-term health consequences are. And so we use that to try to help people become better informed so that they're not just making decisions on coffee consumption based on their just immediate kind of gratifying effects. They need to take into account what the long-term health consequences of that are. And just to go on a little bit more about this, I am also a slow metabolizer, but caffeine has never really given me any problems. And I just enjoy, it's kind of like a morning ritual, having my 2 cups of coffee in the morning when I'd read the newspaper, back when I was actually reading a printed, those old-fashioned things. And when I discovered that I'm a slow metabolizer, at first I thought, okay, well, this is going to be, I should really cut back then because I believe in the research. But then I thought, well, I might feel really exhausted in the morning, and I might get a pounding headache and other withdrawal symptoms. And it really wasn't that bad. It turns out, I was able to switch to decaf. And so I still enjoy that, warm cup of coffee in the morning, but I drink decaf. Now, my wife, who is actually a fast metabolizer, so she's lucky, so she can drink up to 4 cups a day. She thought she would cut back as well, and she just got brutal pounding headaches. And so for her, it was a little bit tougher, but then she realized, well, she's able to metabolize it quite efficiently. So she continues to have a regular cup of caffeinated coffee. So we actually have 2 different coffee makers at home. But we make it work.
Okay, so we've touched on coffee, and the other 2 topics that people are going to want to ask about are chocolate and wine. What about the genetics of those?
Well, I can tell you there is no gene that has been identified that tells you that chocolate is bad for you or that you don't like chocolate.
Thank you.
So that doesn't exist. So let's just take that one off. No, but in all seriousness, I mean, chocolate, certainly dark chocolate, has been shown to have all kinds of beneficial health effects. But like anything, it's probably more beneficial for some people than others. There haven't been any studies, to my knowledge, showing that dark chocolate has, kind of adverse effects in some people. But depending on the type of chocolate, right? If it's milk chocolate and you're, consuming a big portion, right? You're getting quite a bit of sugar, quite a bit of saturated fat, and you have to balance that with the rest of your diet. Alcohol is an interesting one because there have been studies showing that the equivalent, so kind of like a slow metabolizer of alcohol, they actually benefit from moderate consumption in terms of heart health. And that makes total sense, right? Because we know that, a glass of wine a day has been linked to a lower risk of heart disease in populations all over the world. But it turns out in those individuals who don't break down alcohol too quickly, so they benefit from the heart healthy effects, the cardioprotective effects of alcohol. Whereas those who are fast metabolizers of alcohol, they get rid of it pretty quickly, so they get less of a benefit. But it doesn't seem to be linked to harm, at least when it comes to heart disease. Now with cancer, it's a different story. Alcohol, at least for breast cancer, seems to have the opposite effect. So again, a person needs to really weigh the benefits of risk for one disease versus another.
And is this the alcohol sensitivity marker, or is it a different marker?
Yeah, so this is actually, so there's a couple of different ways of establishing alcohol sensitivity. So it's, as you know, some people in certain ethnic groups, it's much more common where they get this kind of flushing of the skin. And that's because they're unable to metabolize acetaldehyde. So that's a metabolite of alcohol that causes you to have basically, symptoms of a hangover. Right. And so those individuals, they don't even benefit from the pleasant effects of alcohol. They just pretty much get the hangover side effects. And for them, they basically just avoid consuming alcohol. But there's another gene that affects just the metabolism of alcohol itself and how much of it circulates in the blood and has cardioprotective effects.
Very cool. Regarding chocolate, I have convinced myself based upon my genetics that I should be consuming dark chocolate. I do not have, so something we haven't dove into that the report looks at as well is how our genes actually influence our food choices. Yeah. So I don't have the genetic sweet tooth, so I don't feel like I'm at risk of overeating chocolate. But I do have some elevated risk in terms of my antioxidant capacity and needing some more antioxidants. So I go for the dark chocolate, not super high in sugar, potentially lots of antioxidants, and I convince myself that I'm doing myself a benefit.
Yeah, I think I definitely have the overeating gene, or the danger of the overeating gene.
The sweets?
Yeah, the sweets, the sugar preference. I forgot what it's called. Is that the sugar preference? Is that that's the GLUT2? Is that what that is?
Yes, yeah.
I think I'm extremely high on that allele.
You don't have the sugar gene, but you do have, you're more prone to having a higher appetite. So you might just like to eat a little bit more, and sugar might be your go-to. Because I think there's also that learned response, right? Like the nature versus nurture part 2, where, so my mom's done this report as well. Mm-hmm. I don't have that sweet tooth, but my mom does. So we grew up eating lots of sweets because she always wanted to eat sweets. Yeah. So I think I have that like learned response to want more sweets.
So how much of a benefit? I mean, this is like an age-old question and an age-old debate, but is it a 50-50 kind of benefit of each, where you start to talk about the effects of what we grow up with and what our environment kind of dictates versus what the personal genetics of what our bodies are metabolizing and require are?
I think it's a very valid question. Ahmed, I don't know if you have a response to that. I can't come up with, and I think it probably depends on each gene and sort of the penetrance of each gene, and then also how strong your upbringing was. But I don't know. Do you have a better response than that, Ahmed?
Yeah, no, that sounds certainly plausible. I mean, it's really tough. I don't think we've actually been able to completely elucidate the contribution of environment and genetics for a whole host of traits. We've tried to take a kind of an individual, and it might differ, right, with sugar as it would with alcohol, or as it would with caffeine. We've actually done some research on cilantro, and that's another kind of really interesting food because it's amazing. I remember when I first discovered that some people actually don't like cilantro, I was kind of really surprised. And I remember I was having lunch with a buddy of mine, and he was picking it was at a Thai restaurant, and he was picking out the cilantro, and I thought he was just saving it for dessert, right? Because I thought this stuff is amazing. And then he's like, "Oh no, I forgot to tell him no cilantro. I can't stand this stuff." And I'm like, "Oh, pass it over here," So it turns out that, cilantro is one of the most, kind of polarizing foods. And it's amazing how many people can't stand the taste or smell of
Is it
cilantro.
really? I would never have thought. I'm with you. It
Yeah.
never occurred to me that it is polarizing and that it'd be noxious to some people.
Yeah, my husband's the soapy taste. That's what he gets, and I can't put it in anything. It drives me nuts. It's so yummy.
Yeah, yeah. And some people describe it as tasting like dirt or bugs. I don't know how they would know that, but that's the common description. And it turns out there is a gene that codes for an olfactory receptor. So it's a sense of smell. And so that obviously influences flavors, because flavors are a combination of taste and smell, but we have many more olfactory receptors than we do taste receptors. And that's why we can detect more smells than tastes. And so I had a former graduate student who looked at the prevalence of cilantro disliking among different ethnic groups. And sure enough, among kind of Middle Eastern and Hispanic populations, the prevalence was much lower. And that could be, either because of their genetics or because it's commonly used in that type of cuisine. I know growing up, my mother would cook various Egyptian dishes that, whenever she'd use fresh cilantro, to me, it was just like, it was awesome. But apparently there are people who have grown to not love cilantro, those who were basically born as cilantro haters, but not mind it. And apparently if you try something, I don't know what the magic number is, 7 or 8 times, you can actually, grow to like it a little bit more, or perhaps, dislike it less. But there's definitely a very strong genetic contributor to something like cilantro disliking.
Is the genetic predisposition of different regional peoples to types of food an area that's researched in nutrition? I think about my background as Persian, and I think about some things like Persians, we really don't have much in the way of spicy food. And I think my sensitivity to spicy food is I could probably pick out one flake of pepper in a million. Whereas it's obviously different. And I wonder, out of interest sake, if that's an area that has been researched.
Not thoroughly enough. And again, we dabbled in this area just out of pure interest. And I think there are, so when we actually discovered the sweet tooth gene, the GLUT2, that was a chance finding. We were actually looking to see if this gene can explain why some people metabolize carbohydrates more quickly than others. So you get this greater glycemic response. So we were studying it in the context of diabetes risk. But it turned out it had no link to metabolism, but it did explain people's behavior, because it turns out it's expressed in regions of the brain that regulate appetite, and it senses blood glucose. So for some people, they need more sugar to get that same signal in the brain to tell them, okay, now it's time to stop. But since then, we found that this gene is also a risk factor for dental caries, things like cavities, decayed, missing teeth. And so we collaborated with a group in dentistry and showed that this link with this gene, and that's not surprising because it's basically the gene is influencing a behavior, and that behavior, excess sugar consumption, without sufficient oral hygiene, is what's causing the greater dental decay. So it kind of went to chance observation and something that is a genetic determinant of an eating behavior to actually have a health consequence. So I think if we do more research on again, kind of the cultural, the genetic determinants of different eating patterns, I think it might help us uncover some other links between diet and health.
That is completely fascinating. And I mean, I think we're probably all science geeks here and love like examining things like that. But the fact that nutrigenomics allows you to really dive into those relationships, that's just so cool. Like I know it's a fairly new science. I just feel like there's so much. Like I don't know how, Ahmed, you decide what your next research project is going to be.
Yeah, I mean, I guess I'm fortunate to be in a position where being a tenured professor, I can decide what kind of research I want to explore. Oftentimes, I try to tailor a project to the interest of the graduate student who's joining my lab. So when we started on caffeine and athletic performance, as you know, Nancy Guest, who's a sport dietitian, that was her interest. So she came to one of my talks and saw that, wow, genetics can explain why, diet has different health effects. I'm a sport dietitian and I see my athletes responding very differently to the advice that I'm giving them. I'll bet that this also explains differences in performance. And so she joined my lab and we created a project focusing on that as an outcome. We've also looked at other outcomes. I have a graduate student who just published her first paper a couple of weeks ago, looking at the genetics of iron metabolism on premenstrual symptoms. So that's another area that's really woefully under-researched. It's something that impacts the quality of life for women, millions of women around the world. Some women get various premenstrual symptoms that are debilitating every month, and they endure it. And we're trying to understand how nutrition as well as genetics can help explain those conditions that they experience.
So Arjang, I think we just found your next project. I think you're going to be a PhD student in Ahmed's lab looking at the connection between genetics and nutrition and skin health. There we go. Because you needed something else to add to your plate.
If I can shave off a little bit of time in my day, I think I'd like to join your lab and do that, Ahmed. We didn't really kind of introduce the whole nutrigenomics tests and that business. And it's so fascinating. We really kind of just dove into the conversation, but maybe I'll just take a step back, because for people who are listening, they may not necessarily recognize that this is a company that you've started, and it looks at genetic samples that individuals give, and you do an array of tests on different types of genes and give back a genetic profile, which will tell a person what their predisposition is to different types of nutrition and different factors in their diet. It seems to me, having this conversation, I've gone through this. So to those who are listening, we're kind of joking because they've done this test on me, and that's what we're kind of talking. Well, I guess you've done it too, Lisa, and we've all done it. It seems to me, having had this conversation with both of you and having had the test done and read the test, that It's really fascinating, and I think it would be an indispensable part of somebody's nutritional analysis. And Lisa, you're obviously a very well established nutritionist. Would you agree with that? Is this kind of why is this thing like a huge test that everybody should be getting?
Um, Short answer is yes. I mean, there's all sorts of things that we need to consider. If you're at risk of disordered eating, probably not the best thing for you to do. If you are suffering from disease right now, we have to look at medical nutrition therapy. It's not necessarily you shouldn't get it done. It just might be talking about prevention of cardiovascular disease. If you've just had a heart attack, maybe we need to work on nutrition for that right away. But honestly, and I work with a great group of dietitians, I would say we recommend it at some point for probably 90% of the people that we see, because there's just so many questions that we can't answer for people. They try to lose weight and they're like, I've tried this diet, didn't work. Well, instead of, trying different diets, maybe we should actually see which one is better for you to do if there are some genetics underlying why something worked for you or didn't work for you. I see it really as being pretty indispensable. We just put through a couple clients today who are getting their test done. I use it with a lot of clients, and what I really like about it too is it's one test that looks at multiple areas, and it speaks to people. I mean, we all have genetics and different genes, but also speaks to the different goals. And people's goals change. So maybe somebody's goal right now is weight loss, but maybe in the future it's sports performance. And maybe after that, it's looking at fertility. And there's genes that play a part in all of this. And I just, instead of questioning and trial and error, I think it's worth paying for it, getting it done, and knowing what your genetic predispositions are.
Yeah, I mean, when I first had it done, I mean, I was curious. But in the back of my mind, I thought, well, maybe this is kind of like doing an ancestry.com kind of thing, like knowing kind of what my back, like 5% this and 10% that. Maybe it's interesting, but I'm not sure it's going to affect. But then having gone through it and having looked at what my genetic disposition was, it did make a lot of sense to kind of find out about what some of my preferences were and what the suggestions were. I did find. And, I think there was one part in there that made me feel great that said I build muscle extremely fast.
Oh, yes. You were nice ultra with that.
Yeah, I think that was a nice ego boost. That was a nice little thing to put in there.
Is that what really stuck out to you? Was there anything else in your report that really...
I
mentioned caffeine for myself.
Yeah. But now you've got another test, Ahmed, and you've got one on skin health. So this is, I guess, for me, what made it really fascinating was the Nutrigenomix is a test that just looks at diet, but then you've got one that looks at the genetics as it relates to skin health. So explain that and what led you to that, because for people who are following us in aesthetics, I think that's really fascinating. And certainly the whole personalized skincare market, not that this is what that is, but there is certainly a strong movement towards genetic personalized skincare. So that really caught my interest, and that's kind of this next test that we did, and you guys did that test based on a sample I initially gave. But what led you to this, Ahmed?
Sure. Well, I mean, even though we are a genetic testing company, I actually like to consider us as being more of a nutrition company, a personalized nutrition company. So we use genetics really just to provide more precise recommendations on diet and healthy eating. And so having said that, again, even though my lab has not done research yet directly on skin health, some of my other colleagues have. And so as we look through the scientific literature and look at the studies, it became evident that, hey, this is, yet another excellent example of how genetics can be used to provide personalized nutrition recommendations for skin health, as opposed to, athletic performance or heart disease or premenstrual symptoms. So it was very interesting for me to delve into that scientific literature and to see the research that's been conducted on things like facial pigmented spots, skin elasticity, and other measures of skin health. In fact, there was just a couple of months ago a clinical trial that was published showing the effects of almond consumption on wrinkles and measurable. And so in terms of, it was an intervention that was done for a few months, I believe about 3 months. And the group that consumed almonds on a daily basis had a measurable decrease in the size and number of wrinkles on their face. And we know, of course, that almonds are an excellent source of vitamin E. And so one of the markers in our panel looks at the genetics of vitamin E metabolism and blood levels and provides recommendations there. There are some genes that influence collagen breakdown in the body and the person's elasticity in their skin. So obviously genetics plays a role and environment plays a role, such as nutrition. And it's interesting to see how some people who have perhaps a genetic predisposition to having, earlier signs of skin aging, that there's actually something that they can do about it. Targeted advice that can help them kind of mitigate those genetic risks. So that's an area of research that I think is going to continue to grow. But again, there's already sufficient evidence for us to have created this report on skin health.
So I thought it was fascinating. I mean, some of the outcomes were really interesting. As you mentioned, there was one about pigmentation, and there was a test in there that outlined a person's risk for having facial pigmentation or increased pigmentation, and I presume that's kind of growth of pigmentation spots. And then there's also, like, you've got things in there that look at vitamin A, vitamin C, antioxidants, sugar metabolism, and how that leads to kind of skin elasticity. So do you think, having said all that, because when you read this, it gives you kind of a what your allele is for a particular gene, and then what your risk is for having some kind of that deficiency within your skin. I guess the next question is, do you think that the next link in the chain is you do a test like this and it tells you that, for instance, your skin vitamin C levels are a little bit low, and you need to increase your vitamin C intake in order to improve that within your general skin health? Is it so specific that you can kind of make those inferences?
So something that we do in clinic when we're implementing this testing is that we quite often recommend that people have their blood measures as well, so that we can look at, the blood measurement of vitamin C isn't amazing. I don't know if there's a way to measure vitamin C in your skin. If that is, I think it's really good to have that instantaneous. What are your levels right now? And that genetic, what are you at risk for? What do you need to get more of genetically? So that's what we usually recommend in clinic, is that if we're going to have this done, also get your blood work done so we can see where you are sitting right now and pair that together with your genetics. So I think that, to me, I'm like, yes, those need to go together.
Yeah, I absolutely agree with Lisa. Ideally, we would like to be able to have blood levels for everyone. In fact, and yet another area that we collaborate on, not to change subjects, but just because we'll come back to skin health, but we collaborate with some urologists at Mount Sinai Hospital looking at male infertility, because we know that diet affects sperm health, and that approximately 30% of cases of infertility are due to the male factor. So again, I love doing research on areas that are virtually underexplored. And what they found was, because they started measuring some of these blood biomarkers of certain nutrients like ascorbic acid, which is vitamin C, the circulating form, as well as 25-hydroxyvitamin D, that they are now running this routinely on every single patient that goes into the clinic, because they found that the levels that there's a high proportion of individuals that have suboptimal blood levels. So what our genetic test does is it doesn't tell you, as Lisa mentioned, your current status. It tells you your genetic predisposition if you're not getting adequate amounts in your diet. But ideally, you would want to have both bits of information. Your current status, which is influenced partly by your recent diet, as well as your genetics, which tells you, all right, is this something you need to be more mindful of and make sure that you're getting adequate amounts every day? Or are you lucky? There's so many aspects of our diet, right? And so many recommendations, so many nutrients. It's tough to keep, up to date with all of these different recommendations. So, as Lisa described how she, reviews a report with the client, you kind of focus on a few things. And if you can focus on improving, 5 or 6 aspects of your diet, that's great. Kind of the low hanging fruit. What is the immediate things that you can do now? And then obviously, we've heard from a lot of consumers who've had our tests through their practitioners that, they've gone back and looked at the report several months later and then saw something else that they're like, oh, I didn't realize that, I also have an elevated risk for, choline. And so, they start focusing on that aspect of their diet as they improve one thing over another. But going back to skin health, skin health, starts from the inside out. And so things like antioxidants, whether they're water-soluble antioxidants like vitamin C or vitamin E that are lipid-soluble, you have to ensure that you're getting adequate amounts in your circulation, because that's what bathes your skin cells and ultimately affects things like premature signs of aging.
So I'm gonna ask again though. Do you think a test like this can ultimately be used to personalize a skincare regimen? And that.
Sorry, I forgot your original question.
That's all right. Well, that's there are companies now that are doing that. So they're doing kind of and this seems to be your specialty, the genetics of your nutrition. And so how valid is that? Do you think it's so specific that you can actually come down to what kind of topical creams that you need to put on for an individual based on their genetic testing?
Yeah, I mean, the science isn't there to clearly demonstrate that, but I think we have enough circumstantial evidence from some of the science that has been conducted to say, you know what, it might not be a bad idea. You have these genetic variants that clearly increase your risk of, collagen breakdown in your skin and loss of elasticity. So whether this particular product is going to help it or not, at least you're bringing their skin health, to the forefront of their mind in terms of recognizing, hey, you know what, maybe I should be more mindful of, staying out of the sun or putting on sufficient sunscreen and consuming, more fresh fruits and vegetables that increase my antioxidant defenses, the defenses in my body that help to, fight free radicals that cause damage to skin, which we know. So again, while the science might not be super robust for some of these products, and I haven't really seen how they're marketed, I think those who I think the test is certainly worthwhile, and if it makes you more, diligent in using sunscreen and other measures like that, then I think that can only be positive.
Yeah, I think it almost goes back to the conversation that we had quite a while ago, one of our Instagram lives, where in the conversation we were talking about the absorptive capacity of our skin. And I think that's something that we overlook on many, many levels, is that, yes, we absorb a lot through our intestines, but our skin has an incredible absorptive capacity. And we see this like with vitamin D. So vitamin D drops that you can put on children's skin. So to me, it just makes sense that we need to look at it both inside and out. I think, and like in my ideal world, if you had this done, it would be that holistic, this is what you need to do for lifestyle. This is what you need to do for nutrition. This is what you need to do for skincare. I know we don't necessarily have that specific research right now, but it just makes sense that we need to do all of that together. I think I would love to see that in the future.
It does make sense. It makes a lot of sense. Because as you say, there's obviously a huge genetic component. We know that. I mean, I know that as a surgeon, that you can operate on different types of people at the same age, and their tissues are just different, very different. There's a different feel to it. But then there's also their lifestyle, which kind of has a strong effect. And so it seems like it certainly wouldn't be 100% accurate, but it seems like this would be a huge component, or at least a set of information that you wouldn't otherwise have access to.
Oh, absolutely. And I like also about the motivating effect of it. Okay. Frozen? Okay.
Did you get frozen? We thought we lost you.
I think it was frozen for a little bit. The motivating effect of it. That, and this is what I see with a lot of clients too, and I think this also speaks to skincare and what you were speaking about, is that some people know things. Some people know that they should be putting on sunscreen. Some people know that they should be eating more fruits and vegetables, taking their vitamin D supplement. But it's not until they get this back that they really start to comply to that. And it might be a little bit of a placebo effect, but to me, if it's an effect, it's an effect. And I think right now, like, it's safe enough to say that with skincare, because we always have to look at, I guess, the benefit versus the risk. And although we might not have that super solid science right now to say, like, yes, depending on your genetics, you should be taking this specific or using this specific product. To me, if it leads to greater compliance and people taking better care of their skin, better care of their health, there's like zero risks to that. So I don't know. To me, I get those questions sometimes too, that people are like, how solid is the science? And I'm like, we're always discovering new things. Well, the scientific community, is always discovering new things. There's always new things coming up in your lab. But I don't think that just because we don't know everything, that we can't use the knowledge that we have and we get from the test and the products that are out there to at least better our health. I don't know.
And like you said, Lisa, I mean, if it's something that's not likely to cause harm and there may be benefit, and it motivates someone to try it, to take those steps, then I think it's absolutely worth doing. Again, I've never really thought much about my skin health, and think back of my earlier years of just baking in the sun. I mean, I have Egyptian genes, right? We've never heard of sunscreen. But now, I wear even like, full length, shirts when I'm out, by the beach, and, I put on like, SPF 60, because, I recognize now that, this is the year that I turned 50, and I realized that, the sun definitely ages all of us. Some more than others, and so it's kind of just a prudent step. I think it's good to take.
Yeah, I just think it's fascinating, and I think there's an element of the more you learn about your own genetic predispositions, I think you kind of take a little bit more ownership over your decisions, and you do recognize that whatever decisions you make will have a unique effect on yourself. So I think if for no other reason, education is really a great reason to go through these tests and just to learn more about your own dispositions.
And can I ask you one question about the the skin health test that I've been kind of wondering about, and I don't know if there's any tie here. So I know in the complete genetic test, we look at the ACE gene, which has to do with sodium responsiveness and hypertension or high blood pressure. And part of that is kind of like water retention. I was wondering if you've come across any relationship, and I'll tell you why I'm kind of asking this, between that gene and skin health. So why I'm asking it was that I had a client who came back that she did have that elevated risk, that she did need to really reduce her sodium levels. And the biggest thing that she found, she's like, oh, the puffiness under my eyes that I've been trying to get rid of is gone. And my skin is better hydrated. It doesn't feel as dry. And when the skin panel came out, I was like, I wonder if there's a tie there, if that should be tied in at all. Have you come across anything like that?
That's interesting. No, I mean, I haven't personally. I mean, because again, I don't see patients, but that is certainly quite intriguing. And I mean, I have heard of, obviously, kind of for some people where water retention is an issue and they just feel puffy and have bags under their eyes and struggle to try to alleviate that, usually with topicals. But to hear that a dietary modification helped certainly doesn't surprise me, but definitely suggests that maybe there's something to that we would probably want to explore.
Lots more research to be done. RJ, you gonna start into that research?
Yeah, that's right. So Ahmed, how big do you think this market is for nutrigenomics and skin health? Is your company predicting that this will be a growing market going forward?
Well, we started offering it just partly based on demand and request from some of our practitioners who, again, even though they're nutrition professionals, they also, work in the area of skin health. And that's when we started to explore the research that has been conducted. Again, it looks like that research is continuing to grow. I mentioned the almond study and skin wrinkling, and just that was published actually just about a month ago. So I think as more and more research is conducted, we'll have an opportunity to expand our panel. So that's just really kind of increasing our knowledge base. But in terms of increasing the market size, I've been actually quite surprised as to how many are actually interested in this test and wanting to do it. And I guess my surprise is just because it's not something that I initially had thought would be, something that would be very big, but it turns out there's a lot of interest in that. Just as people are interested in their heart health, they're also interested in their skin health and how they look. So it's definitely something that's only going to continue to grow.
Yeah, I think you're going to find that it is a big market. I think people are fascinated. I think especially over the past year, I think the whole skin industry has really boomed and people are taking more care of themselves, better care of themselves. And I think the more information somebody can have about themselves, the better. I think you'll see that. Would you agree, Lisa?
Absolutely. And I would say that's kind of why we came together, is because we see this mutual interest with our clients or our patients, that they're coming to you for skin health and overall appearance, but then there's this relationship to what they're eating. And we have the same thing from clients, is that they don't always come up with, I want to improve my skin health through my diet, but it comes up a lot. And it also comes up in terms of that improvement too, that people don't, I think they're just becoming aware that what they put into their body affects their skin health. And I think the more awareness we get, it's just going to keep growing. And I'm not surprised that there's going to be more research and that potentially there's going to be products coming out that are tailored towards your genetics. Will be interesting to see. And hopefully there'll be more research in that area, but absolutely. The two areas that I see that people don't necessarily say that they want to work on, but then tell us that they get those additional benefits: skin health. So this, like, more glowing skin, not having the bags under their eyes. And the other thing that you mentioned too is fertility or sexual health. That we get a lot of people, because I'll talk to them about the report and that this is also important. And it's kind of those two areas that I think people are just finally starting to acknowledge that there's that relationship.
Yeah. Well, this has been fascinating. I mean, I'm just thinking about our next interview. Maybe we should be looking at.
What are we going to
Yeah, maybe we should be looking at one of these personalized skincare regimens and bring Ahmed on as a panel guest. Yeah. that'd be an interesting conversation. But thanks, Ahmed. This has been really fascinating. I'll ask both of you, because I'm totally fascinated by nutrition and diets. What is the nutritional trend that you are most fascinated by? And we can end on that. Lisa, you go first.
Most fascinated by. I mean, I have to admit, and this is how I met Ahmed, I've been obsessed with nutritional genomics since the second year of my first degree. So this will continually intrigue me. But I have to go back to skin health. And I think that's because getting a little bit older, it's become more near and dear to me. But what you put in your body and how it affects your skin, I have to say that really intrigues me right now.
Ahmed, what about you?
Well, I mean, as tempted as I am to say, personalized nutrition is kind of being the latest trend. I actually don't view it as a trend, because to me, trends come and go. For me, the genie is out of the bottle. We know that people respond differently. We know how to predict those differences in response. There's no way we're going to go back to giving generic one-size-fits-all advice. It's just a matter of how more precise we're going to get and how more personalized, and what other tools will we be able to use. There's a lot of interest in the microbiome. The science is still a little bit in its premature in its infancy, but perhaps one day we'll be able to add more measures in terms of the bacteria in our gut and how that can help us further fine-tune the recommendations that we give. But it's all about personalization. I think it's just a matter of how that gets delivered. There's a lot of interest in wearables. Not just, Fitbits, but also, Oura rings. I use that to track my sleep patterns. People wearing continuous glucose monitors, and they don't have diabetes. They're just trying to regulate their blood glucose for health reasons. I think we're going to see more of these technologies being developed, perhaps sensors that measure the nutrients in your skin, and through a wireless device will signal, okay, you're low in this and you need a bit more of that. Those are probably kind of the more 5 to 10 year trends that I think we'll probably see down the road. But again, all about personalization.
It's fascinating. Okay, thanks, Ahmed. This was a great chat, and we hope to do it again. Hopefully in the future we can do it in person.
Thank you for having me. It's been a blast.
Thanks. We'll talk to you soon.
Bye, Ahmed.